If you suffer from keloids and you are pregnant, you need to pay attention. These things we don't typically practice, but these are safe things to do for anybody who wants to heal their tissue with minimal scarring. Bonjour everyone, Jennifer Laurette here, and in this video we're going to be talking about keloids. Are basically hypertrophic scars that are made up of an excess amount of collagen. You have different types of collagen within your body. The collagen that is activated or involved in healing is type 3 collagen. So you're probably very familiar with type 1 collagen, right? Our bones, our teeth, our nails, our hair. But type 3 collagen is more of a rescue remedy that comes in when you need to heal an area quickly. So it's a little more disorganized, it's not as stable. So type 3 collagen is what is created when you're scarring, which makes a great form of collagen for healing, right? Rapid healing. You don't want to bleed forever or have an open wound forever. All people who suffer from keloids, that healing is in overdrive. So they produce an excess amount of When do people see keloids first? You typically see a keloid with any break in the skin. So it could be surgery, right? A surgical scar that is trying to heal now. After a burn, after piercings. I know a lot of people who get them behind their ears, right? Or belly button piercings. Some experience it with tattoos if the needle penetrates deep enough. I have also heard of people experiencing it hypertrophic scars with acne that, will take a very long time if they do ever disappear, because keloids are typically for life. When you start to form a keloid, they do not have to be removed because they don't harm you in any way. You can leave it for life, but most people typically like to get them removed or corrected because of cosmetic, aesthetic purposes. Now, how do you prevent these keloids? You have to know that you suffer from them in order to know that you need to try to prevent them. These things we don't typically practice, but these are safe things to do for anybody who wants to heal their tissue with minimal scarring. For example, applying pressure to that area. So let's say you had an abdominal procedure like a tummy tuck. Applying pressure will prevent the excess formation of the scar. Another thing is making sure that the area is well lubricated with silicone. People use a lot of silicone patches that you leave on for about 12 hours, and you leave that silicone patch on and your body just naturally absorbs it to loosen up the area. Two therapies that are very common: laser and cryotherapy. So cryotherapy basically is a way of freezing, and it might take more than one procedure, and eventually it is removed. If you wanted to get it removed, surgery is another option. I should note that occasionally, while the keloid is forming, people can feel the sensation of burning, tingling in the area, but they're traditionally painless. Okay, so now we have to talk about why I brought this up. Why am I bringing this up? Because I personally saw a patient and has a history of keloids, and a very common procedure that is done during childbirth is called an episiotomy. They cut and make an incision at the lower part of your vagina to expand the opening in a very intimate area. You have a chance of having a keloid in that intimate area. We are seeing a patient, very young, very active, very healthy person, and she has a history of keloids. So they had to nick the lower part of her vaginal opening to make it a little bigger. They stitched it up, but now she formed a keloid. Now remember, keloids do not happen immediately. So it's a very slow, progressive growth. You will not notice it. Some people don't even notice it within 3 months of having the injury. Sometimes people notice it a year after having the injury. So here it is. Her child is about 3 years old, and she just keeps feeling something in her intimate areas. Her partner is beginning to feel something in her intimate areas. So she comes in and has a check, and of course there is a hypertrophic scar tissue in her vaginal canal. Painless, because keloids typically are painless after they have progressed. The attending OB decided that he was going to do cryotherapy, which is the therapy that I mentioned earlier that involves freezing the area. So she came in for about 4 or 5 sessions of cryotherapy, and eventually the cells were able to be removed. Peace for now.